My project was a policy analysis of respite care in British Columbia. So before I get into defining respite care, I think it's important to discuss the language that we use. In the past, to define disability, Canada used terms like deficiencies, ailments, or inabilities. These words reflected society's view of special needs children and how they were treated, which led to children being institutionalized. Over the years, we've created more inclusive definitions for disability, like on the slide, but governments have failed to agree upon one common definition, which affects policy formation. This means that people with disabilities often face non-inclusive environments, and child disability rates are drastically underreported. So one critical social support for families with special needs children is respite care. Simply defined, respite care is the provision of short-term and/or temporary relief to those who are caring for family members. Most services focus on the caregiver, so respite is a break, a chance to rest or recharge, to maintain relationships, or to go to work or school. Modern services also focus on the child's needs, so respite can be for personal care or to develop independence or friendships in the community. So the purpose of this analysis was to examine BC's respite care policies and programs, as well as caregiver benefits and income supports as they impact BC families with special needs children. My population was families with special needs children between 0 to 19 years of age. And the reason why I focused on this group, because I wanted to examine the unique stream of programs available for this population. My practicum placement was the Cridge Center for the Family. And this particular program offers or enables families and care providers to connect with each other. My stakeholder group was the Respite Care Committee of Victoria, BC, and each committee member works at an agency that delivers some form of respite care. And finally, to write this policy analysis, I did a literature scan of respite policies and services in BC and the greater context of Canada. Then I compared BC to other provinces and Canada to some international models. To describe the types of services and barriers to access, I had informal interviews with 11 respite care committee members from 7 agencies. So, when I first entered this journey, I envisioned that respite care was the top of the funnel. And through the process, I realized that what families actually get in BC is probably closer to the bottom of the funnel. Respite care in Canada is nested within national home care policies and is delivered through provincial home care services. Funding comes from the National Health and Social Transfer Payment. In BC, home care services are publicly administered under the public provider model. BC has some publicly administered respite programs, but in 2010, most were shut down with ministries reshuffling. In lieu, BC offers subsidies where parents receive a monthly amount to pay for respite care. Most services in BC are delivered by nonprofit agencies under a mixed service model, where nonprofit agencies must find funding, typically from small ministry contracts and charities, and deliver services to the population. The ministry screens for eligibility for many of the programs. So this slide is just some examples of respite care in BC. There's 4 main types. So there's public programs, respite subsidies, charity-based programs, and some nonprofit programs. Additionally, the federal government directly delivers respite care to 2 populations. So the Military Family Resource Center offers emergency leave for military dependents, and First Nations and Inuit Health Branch offers parallel services, federal services in parallel to the provincial government. Canada also offers, under National Home Care Policy, 2 cash for care programs to compensate caregivers who can't work, and that's the Compassionate Care Benefit and Employment Insurance. Finally, the federal government funds individual tax credits for special needs families to compensate for the extra costs associated with disability. So the key issue across Canada and in BC is that policy has not situated respite within a coordinated network of services for special needs children and their caregivers. Instead, respite is nested within national home care policies that prioritize short-term post-acute care but not community care. Caregiver benefits and tax credits inadvertently ignore the needs of the population. So across BC, respite is underdeveloped and inconsistently applied because BC doesn't have respite care policy. Rather, programs tend to be operated independently and have rigid eligibility criteria, long wait lists, income testing, and co-payments. non-profit agencies have precarious funding situations and are only delivered in certain regions. So because BC lacks any reporting measures for respite care, we have no idea how many families actually pay for services on their own. So without quality programs, I have some statistics here, 73% of parents across Canada are forced to alter their employment situations, including quitting their job. Most caregivers are mothers who spend 50 to 60 hours per week on caregiving and advocating on top of housework and employment. As a result, 90% are forced to alter their employment situations. These families are often forced into poverty. 27% of disabled children live in low-income families, and this is compounded for Aboriginal families based on a tug-of-war between federal and provincial services. Family health is impaired. They are at a greater risk for physical, emotional, and spiritual health problems, and child health is impaired. Children are 2 times more vulnerable to abuse and are overrepresented in child protection and institutions. So in the long term, these children have poor future health, education, and employment outcomes. National and international scans of the literature indicated that quality respite services are an essential work-related support and are just as important as high-quality childcare. So quality respite services include respite care policy, municipal councils that deliver public respite services, caregiver short-term allowances and long-term pensions, flexible employment and leave benefits, and non-income tested, non-taxable and refundable tax credits. Quality services increase the likelihood that parents will take less time off work due to stress or sickness, reducing the impacts on employment and income, reduce the likelihood they are forced into poverty, improve family and child health and well-being. They also reduce parental distress, which reduces placements in institutions and child protection. Research indicates that the earlier families access quality services, the better prepared a child is for the future, including improving functional ability and often providing the skills to live independently. So in BC and in the greater context of Canada, Canada does present some opportunities for improvement. For example, significant investments have been made to improve access for people with disabilities for healthcare and social services already. Canada has already invested in comprehensive childhood development strategies. The infrastructure for good respite services is actually already in place, and many provinces have already taken the lead to institute measures to improve services. So if Canada was to dedicate yearly funding for respite and then created bilateral agreements with the provinces, the federal government could set conditions on funding, including encouraging the provinces to set provincial respite care policies, create a common core set of services, standardize respite care, which would mean that care provider training and pay levels could be standardized, and create employer legislation that would allow flexible employment and leave benefits. Canada could also expand the compassionate care benefit and tax credits to be beneficial for the population. And in BC, under respite care policy, the MCFD could deliver respite services and offer a central point of access. BC could revise eligibility criteria and include the risk of developing disability, which would they could also eliminate waitlist income testing and co-payments. So in performing this analysis, I did have a few challenges. BC doesn't have a whole lot of literature related to respite care. Thanks. It was also difficult to link respite care to health indicators in the literature, and I was unable to get much information from the MCFD related to barriers to access to their services. But to buffer this, key experts from the Respite Care Committee helped me to clarify service delivery and funding arrangements and to describe the barriers to access. So I would like to thank the Cridge Centre for the Family for their ongoing support and encouragement, and especially for their attendance today. Thank you. And I'd like to thank the staff and my family and friends for their encouragement. And this is my son, Zachary, who has cerebral palsy, and he's my inspiration. So thank you. Any questions? I didn't really mean any questions. No.
Thank you, Jolene. We have a quick question from anyone. Come on, no? One of the things that Jolene and I share is that we're both parents of children with disabilities. And as children migrate from the child care system into the adult system, if you're going to be eligible for CLBC services, Community Living, British Columbia services, you actually have to be designated by the DMTR4 mentally retarded. So the language that we're talking about still persists today.
Helen Christensen, thanks Jolene, that was excellent. I also have a special needs child, and we just recently went through the designation process, and it was highly traumatic, and I just wanted to say that it is upsetting that the language is still there.
Thank you. Okay, thanks very much.